Good day, everyone. I am Justin Miranda, and today I'm going to talk about Rhonchi lung sounds. So, the first part of the lower respiratory tract is the trachea. It is a main passageway through which air passes from the upper respiratory tract to the lungs. From there, it branches off into two bronchial tubes that extend into the right and left lungs, and then branch off into smaller tubes called bronchioles ending at alveoli. Depending on the person's condition, some parts can produce sounds like rhonchi. So what is rhonchi? Rhonchi are continuous breath sounds heard during inhalation and exhalation. The sound often comes from copious secretions in large airways or bronchi. Rhonchi occurs because of the narrowing of the airways. What does it sound like? The sound is often described as sonorous wheezing because it often sounds like a combination of snoring and wheezing. Ronchi are musical low-pitched sounds similar to snores. Ronchi can usually clear with coughing. As air rushes past these secretions, it creates turbulent flow leading to classic description of Ronchi as snoring, gargling, or rumbling sounds. So what causes Ronchi? Rhonchi sounds are most often caused by a blockage in the airway caused by fluid, mucus, or other secretions in the lungs. They are often heard in patients with pneumonia, bronchiectasis, chronic obstructive pulmonary disease, and cystic fibrosis. Treatment for rhonchi. Inhaled medications including bronchodilators such as albuterol, Ventolin, or Proventil are frequently used for the immediate relief of symptoms. These medications result in a dilation of the airways, which increasing their diameter and allows for more air to pass through the airways and reach the lungs. So here's an example of bronchi lung sounds.